Hello, my name is Lex and I'm a health educator at MaineGeneral Medical Center. This video will cover basic overdose prevention and how to use Narcan when responding to an overdose. First, we will cover some of the risk factors for an opioid overdose. If you have overdosed before, you are at higher risk of a fatal overdose. Additionally, individuals who have been released from jail, have undergone a detox, or are returning to use after a long time without substances are at a higher risk of a fatal overdose. This is because their tolerance is low. Many people think they can use the same quantity or the same frequency as they had in the past, but their body can no longer handle that amount. In the first 2 to 4 weeks of returning to use, an individual is 4 times more likely to experience a fatal overdose. Other risk factors for an overdose are using opioids that are not prescribed to you, taking more than what is prescribed, mixing opioids with other substances such as alcohol, benzodiazepines, or anything containing a sedative, and having other conditions that put you at respiratory distress such as asthma, emphysema, and sleep apnea, among others. Next, we will talk about the signs and symptoms of an opioid overdose. The major signs of an overdose are if the person becomes unconscious or unresponsive, has difficulty breathing, starts turning blue in the face, lips, or nails, or starts to make snoring, choking, or gurgling noises. If you see these signs and suspect an overdose, we recommend giving the individual Narcan. One of the benefits of using Narcan is it can only be used to reverse an overdose. There are no adverse effects to using Narcan if the person has no opioids in their body. When responding to an overdose, the first thing you will do is recognize the signs of an overdose and check for responsiveness. The best ways to check for responsiveness are to perform a sternal rub on their chest bone or a philtrum rub. A philtrum rub is when you rub your knuckles in the groove above their upper lip. The next step is to check for breathing and a pulse and then call 911. When you call 911, be sure to tell the dispatcher the address, phone number, and any details you know about the situation. It is important to remember to be kind, unlock your doors, and keep your phone close by. You are then ready to give the person Narcan. The first thing to do when giving someone Narcan is to get the individual on the floor laying flat on their back. You will then open one of the blister packs in the Narcan kit by peeling the foil on the back. You will then hold the applicator between your pointer and middle finger, insert the tip until your fingertips hit the tip of their nose, and then push the plunger all the way in. You will then want to roll them onto their left side into the recovery position, with their head resting on their left upper arm and their right arm and leg resting carefully across the body. After 2 to 3 minutes, if the person is not yet responsive, give them another dose of Narcan. Repeat this cycle until the person becomes responsive, EMS arrives, or you run out of Narcan. Always stay close by until help arrives. When an individual becomes responsive, they likely will not feel well because their body will enter immediate withdrawal. While keeping yourself positioned across a room, calmly and quietly explain what happened, that you gave Narcan, and that EMS is on their way. A responsive person is not obligated to go to the hospital, but it is recommended. Narcan wears off 30 to 90 minutes after use, so it is possible to go from withdrawal back into a state of overdose. Maine has a Good Samaritan law for opioid response. Maine Revised Statute 17A1111B. This law basically states that if you are calling in good faith when responding to an overdose, you may be immune from prosecution as it relates to possession or acquisition of drugs, possession of paraphernalia or supplies, or violating probation. This is to encourage people to always call 911 when responding to an overdose. It could save a life. Narcan should be stored at room temperature away from light. If Narcan gets too hot or too cold, it will not be effective. It should not be stored in your vehicle. Narcan is safe to use. There is no limit on the amount you can use, and there are no adverse effects if you give it to someone who is not actually overdosing on opioids. If you suspect an opioid overdose, it is safer to give Narcan. Narcan is also safe to use on children and pregnant women. It is really important for these populations especially to always get follow-up medical attention. To access free Narcan kits or for any questions, please call the MaineGeneral Hub line at 872-4102.